Hello, everyone, and welcome to today's webinar hosted by the International Society for the Prevention of Child Abuse and Neglect. We thank you for joining us today and appreciate all you're doing to help children during this challenging time. COVID-19 continues to have a profound impact on children, families, and communities around the world. While children may not have been as affected by disease as adults, the indirect effects and impacts pose a clear and present danger, particularly to those most vulnerable. The combination of movement restrictions, closures of schools, and loss of livelihoods has created a perfect storm that increases the risk of children experiencing physical, emotional, and sexual violence, both now and in the months and years to come. In this webinar today, Tamara Tutnjevic Gorman and Bill Forbes from World Vision International will present findings from the agency's recent report, COVID-19 Aftershocks, A Perfect Storm, and discuss projections and the latest data on the impact of COVID on violence against children. They will also share examples of the World Vision Child Protection Response and offer some practical lessons on implementing interventions during the pandemic. Right now, I have the audience on mute to avoid background noise. We welcome you to enter any questions or comments in the questions box throughout the presentation. The presenters will respond to questions at the end as time permits. The recording and slides from the webinar today will also be posted on the ISPCAN website for a limited time after the webinar. Then they will be archived and available for members only. Tamara Tutnjevic Gorman is a Senior Policy Advisor for Ending Violence Against Children for World Vision International. She has over 20 years of experience in child care and protection system reform, as well as in policy and program development to address violence against children. Previously, Tamara worked with a number of international organizations on strengthening policies for realization of women and children's rights, including Oxfam, UNICEF, ILO, and the World Bank. Bill Forbes is the global lead of child protection and participation for World Vision International. He provides strategic leadership to World Vision's efforts to strengthen local prevention and response to abuse, exploitation, and neglect of children, as well as strengthening children's voice and participation in the world's most difficult places. This includes World Vision's work to address child marriage, child labor, street children, child trafficking, sexual abuse and exploitation of children, children affected by armed conflict, gender-based and domestic violence, and child safeguarding. We thank you, Tamara and Bill, for being with us today. Now I will turn it over to Tamara, who will be our first speaker. One moment.
Oh. Good morning, everybody. I'm just going to say hello, and I will proceed with my presentation so that we don't use too much bandwidth and have a good connection. I hope everybody can see the presentation that I'm going to show right now. And as Heather mentioned, I will be talking about our Aftershocks Perfect Storm report. We know that at the best in the normal circumstances, we have about 1 billion children experiencing violence every year. This is the data that was developed by the CDC and WHO in the past 2 years. But we also know that any type of crisis increases the vulnerability of children to violence. And whether that crisis is brought by conflict, by natural disaster, or by pandemics. We have seen that also in connection with the Ebola pandemic. The thing is, this situation is vastly different than Ebola, but led us to believe that we can, that something is going to happen to children and that we need to pay attention what is going on when it comes to violence against children. As we spoke earlier, the COVID virus does not affect so much children, their health, but the impact on other aspects of their well-being has been really strong and staggering. So as the pandemic started, we suddenly started to see a number of different newses, number of different reports that were all pointing out to the situation of increase in violence against children. So many children were left at home. I think the current figure is about 60% of world children was at one time locked at their homes due to the confinement measures. And we suddenly seen quite a lot of increase in the calls to domestic violence helplines. Some of these helplines were devoted to children, some of them were devoted to domestic violence in general, some to women. But we've seen a real spike, particularly in the first 2 months of the lockdown measures. We have also noticed that the children, now that they've been locked at home, particularly in countries where there is an access to internet, they were pushed almost into internet space, which already hasn't been very safe for children, as we know. So we've suddenly started seeing different reports from Europol, from National Center for Missing Children, all noting up the increase of children being exposed to violence in this sphere. And then the first projections also started to come up. I think the UNFPA has made a projection that 50 million gender-based violence cases will be happening over the period of 3 months long lockdowns. And in our own programs, we suddenly noticed, particularly in a very fragile context such as DRC, increases in incidences of child labor. So it was pretty clear that the confinement measures were putting children in places where they may have never been safe, or that became really unsafe due to the stress and anxiety that was driving a lot of the people to resort to violence in this kind of circumstances. As the lockdowns extended, that we are now in about our 6 months in some places, we have seen the economic implications being much stronger, and the concerns have been strongly raised that some of the parents or families will start resorting to negative coping mechanisms. All of these, like child marriage and child labor, all of this is nothing that we haven't seen before, except maybe for such a spike in the domestic violence. I'm trying to move it. So what is in this report, Aftershocks, a perfect storm? We've seen that a perfect storm was happening, and I think that was pretty clear to anybody who has been in this field for quite a lot of time. And we needed to say and do something to draw attention to this issue. We have done in this report projections of trends in increase of violence against children, which was based on the current baseline of the violence against children, as personal violence, sexual violence, and physical, sexual, and psychological violence, which was 1 billion. We have looked at the trends in the first 60 days of lockdown, and in particularly trends of the increasing calls to domestic helplines, because those were the only data that we could see. And we were seeing, particularly looking at the interconnection between intimate partner violence and child abuse, because that one is very well documented and established in the literature. And we have used basically domestic violence increase as a predictor for the figures that we come up with. And this report for us was really important because we wanted to call for issue to be prioritized in national responses, because national responses at the time and even now are mainly being focused on either in responding to the health emergency crisis, which is absolutely fine, or they are now getting a more form of economic crisis response. But the violence against children has not received as much as attention as normally never does anyways. So what we have come up with is that when we did our projections and applied them to the baseline that existed for different regions, we came with a really big number of the up to 85 million children, in addition to current 1 billion children, may be at risk of violence against children within the first 3 months of the quarantine. And that number was a really big number. And when we've done our projections, we based it on a modest increases of 20 to 32% increase in violence against children. Since the report was published, we have monitored the trends that we can see receiving from the field as we do different assessment. And as everybody knows, probably on this call, it is really hard to get accurate data on incidences of violence against children, because of the fact that data systems are not existent or not very strong. The nature of this emergency has also limited access to children by professionals and trusted adults who would normally be able to report and see these cases. And finally, children themselves may not have access to the reporting mechanisms, or in some instances, they are not even legally kind of allowed to report the violence against them. So in a way, the only numbers that we were getting were these numbers were the numbers that were used for the projections from the calls of the SOS hotlines. In addition to these global numbers, which is between 52,000 and 85,000 additional children, we have done some projections also for the child marriage, because that was another thing that we were looking at as a long-term kind of impact, as an impact on children that can start showing in a little bit medium to long term. And our projections were based on the work that UNFPA has done and warned that 13 million more girls will be in next 10 years exposed to child marriage. But our analysis and experience from the field shows that given the age of the girls, given the severity of the economic crisis that we were expecting, the effects on child marriage will be greatest in the immediate period of the first 2 years. And we projected that about 4 million girls will be exposed to violence against children, to child marriage in this next 2 years. Now, why was it important to make these projections at the time when they were made? And that was already, I think, almost 2 months ago. It was important because we often in our sector, in the child protection sector and the violence against children sector, we want to be very accurate and we wait for the correct data, but it is really hard in this situation to get that kind of a data. And it was really critical that we start acting now so that we make sure that these kind of projections actually don't come through, that we don't see these girls married, or then we don't see any more children exposed to violence against children, and we absolutely need it. And so some of the recommendations that came up with the report focusing on a couple of things, and I highlighted here 4 because they are still quite important, and they are, even though we are entering and exiting this confinement measures in this period of global pandemic. One is to prioritize child protection and essential child protection workers, whether they're formal or informal, in the national responses. We haven't seen that entirely happen everywhere, but we have seen the initiatives, and I know my colleague Bill will talk a little bit more about what we're seeing in the field. But it is absolutely critical that we have child protection high on the political agenda, which we know it never is, because even if like in a place where I live in Cyprus, we have ended up confinement measures about a month and a half ago. But the truth is that violence against children will just not stop because suddenly things have opened up and the consequences are long lasting. So we have to make sure that these systems are in place. We also have to ensure continued functioning of child-friendly survivor-centered reporting mechanisms. They proved extremely important in this crisis, particularly child helplines, because they were the only lifelines for a lot of children to draw attention to what is happening to them. And it was important because we could have adopted them and worked with them in ways that were remote. Also, because of the economic pressures that the families are feeling, the social protection measures needs to be in place for the most vulnerable children, and not just short-term income support, cash transfers, but also investment in the social services that are critical for children, because we wanted to make sure that we take into account long-term impact and long-term response to child protection issues, and not just something that is bridging families over the period of a month or 2. What is also emerging right now in this crisis, in the economic crisis that is following the COVID outbreak, is the expenses that governments had, and also the slowdown of economy, which is all kind of raising a lot of concerns that we are entering a period of fiscal austerity. And in that period, we really need to safeguard investment in child protection. I don't know how many of you knows, but the ODA, for example, aid that is going to child protection, is less than $1. It's only 0.65 cents per child, which is really a cost of a lollipop that goes to 1 billion children. The second thing is that most of the governments now we don't know, and they don't know exactly what their investment in ending violence are. And as faced with austere measures, they may make choices to cut some of the basic services. And child protection is not ever on that high agenda. So we really have to be asking to keep this investment going. And before I finish this presentation, I just want to say that I'm happy to talk a bit more about methodology if people are interested. But I want to say that we are aware that there's several limitations to the work that we've done on projections. But we did felt that at the time, we did felt that it's important to put a number on a problem. And since that period of time, we have done different other assessments, and other organizations have done different other assessments. And what we are seeing is that there is particularly consistency with some of the figures around child marriage, or the figures around domestic violence or violence at home against children. I'll just give you one example that we've seen in a recent assessment we've done in Asia, that exactly the same number of children are 32% of children is reporting the increase in violence at home. So unfortunately, our predictions are proving to be truth, and they are not far off from what we are seeing now. I will stop now and move into this second part of our presentation, I'm sure, where we can learn about more what we can do to respond to this crisis. Thank you very much all for your attention.
Okay, thank you. Now we will turn it over to Bill.
Okay, good morning. Can you hear me?
Yes.
I'm going to say a quick hello here on video. Just hello to everyone. I'm going to shut off the video so you don't have to look at me, which I'm sure you'll be pleased to hear, but I wanted to show you that I am a real guy here behind the computer. So let me turn off my computer. Good morning, everyone, and start my presentation here. Let's see. Can you see my presentation?
Yes, thank you.
Excellent. Great. Thank you so much. Thank you, Heidi and ISPCAN, for the opportunity to speak today. Thank you, Tamara, for presenting those compelling projections. I remember when we first came out with those projections of 60-some million average estimated additional children experiencing violence in those first months. It was pretty shocking, and the additional child marriages was certainly motivating for me. I want to appreciate ISPCAN just really for all the work that you do. I miss the congresses, I miss the meetings, but I'm so grateful for how the society has pivoted to continue to facilitate learning. Particularly have appreciated the research and practitioner focus of the ISPCAN webinar since COVID-19. So I'm going to shift the presentation now from this Aftershocks report, which focused on the projections of violence and the risks and realities that children are facing under COVID-19, to share for a few minutes about what World Vision is doing to respond to these challenges. Specifically, I'm going to share the operational perspective from the field. What are our field staff seeing? What are we doing in the field? What challenges are we facing? And what are we learning as we do that? So we're active on the ground. We're a community-based organization responding in over 70 countries to COVID. This is the biggest initiative that World Vision has ever undertaken, like many agencies around the world, impacting communities and families and children everywhere that we work. We've never had anything like this before. Thankfully, we were able to build on pre-existing relationships and programs and pivot quickly to respond to COVID-19 and its impact on children. We're focused on 4 objectives you can see here at the bottom of the screen, near the bottom. The 4 objectives globally in our response to COVID. First is measures to prevent the spread of COVID-19. The second is to strengthen health systems and workers to continue other essential health services such as vaccinations of children. The third is looking at the particular impacts on children particularly in the areas of child protection, education, food security, and livelihoods, and bringing support to those children and households. And the fourth is focused on advocacy and collaborating to ensure the protection of vulnerable children. So before I share specifically what World Vision is doing to strengthen child protection in this broader response, I want to share 5 quick observations here which have shaped our efforts thus far. And these emerge from a number of conversations I've had with the field over recent weeks, and even a number of them this week. The first one around the combined pressures of the economic crisis and school closures, it really is bringing great pressure on households. The millions and the UN has projected that up to 66 million more children will fall into extreme poverty during this time. We have over 1 billion children who are lacking school learning opportunities with the school closures. We have ourselves have talked to thousands of children and caregivers in dozens of countries, and they tell us that their families are stressed, overwhelmed, anxious, bored, frustrated, scared. We've heard the gamut as we've listened to children. We also need to recognize the multiple burdens on caregivers, especially women who are even in situations where perhaps the family is able to go back to work or maintain work. The multiple burdens now with having children home from school around the world are just really taxing on families and causing great pressure on households. Of course, all this greatly increases the risk of violence against children in the home. And that brings us to our second point. Around the world, we are indeed seeing signs everywhere that the projected increases in violence against children are actually happening. As Tamara said, whether that is increases in hotline calls or domestic violence and child abuse arrests in Mongolia, Uganda, South Africa, or informal reports as we're in touch with child protection committees in countries like the Philippines or Peru, we see signs of increased physical abuse, domestic violence, substance abuse, neglect, sexual abuse. In India, we recently worked with local partners to intervene to stop child marriage, a number of child marriages. In the Philippines, specific cases to stop the online sexual exploitation of children. And this week, I've heard reports of increased female genital mutilation or cutting in Somalia, child marriage in Kenya and Indonesia, and child labor in Lebanon. And as Tamara said, these are consistent with the impact on children that we've learned from previous pandemics and epidemics. So we're also seeing, the third point here, some increases in new types of incidents in certain areas. So for example, in the West Bank, where we're working, we've seen a real spike in adolescent pregnancy and an increased adolescent suicide attempts. Also, there's, of course, a lot of evidence, as Tamara said, of increased violence against children online, including online sexual exploitation, cyberbullying, exposure to pornography, and other harmful content. The fourth point here focused on the acknowledgement and operationalization of child protection and social services as essential. It really has just varied so much across between countries as well as within countries. And in many cases, even where governments have taken up new policies to look at to have child protection and social services deployed and responding to the particular challenges, these policies have not been rolled out. Also, in a number of countries, we've seen a shifting of the social workforce to COVID, from social services to families to focusing on COVID, for example, in the Philippines and Indonesia, but in many countries. And then finally, the child protection systems were already stretched before COVID-19 hit us, as we all know. Piled on top of that now are the restrictions and challenges and unpredictability posed by COVID. And so with systems such as reporting and referral mechanisms or case management, they're inconsistent even within countries themselves, inconsistent across different provinces and parts of the country. So these observations from the field mean we've had to pivot, and we face a dynamic situation day by day, week by week. I'd like now to give a quick high-level summary of our child protection work in light of these observations from the field. For our particular child protection work under COVID, we're still taking a systems approach, seeking to strengthen the protective environment. We've been building on the work we've been doing to strengthen child protection systems, work with child protection committees, local volunteers, faith leaders, local authorities, caregivers, and children themselves. The trust and relationships and communication we already had with community members and partners, down to remote villages and urban slums, was critical for us to be able to adapt to this disaster. Our child protection work in the initial response focused on these 4 objectives that you see around this slide. I'll quickly tick through these, referencing a few examples for each from country programs that I've spoken with recently. The first one was around the ensuring and adapting reporting and referral mechanisms, ensuring that they're in place and updated to the current challenges. Many of the typical reporting mechanisms have been disrupted, of course. Teachers in particular, and peers, time with peers for children. And even when incidents are reported, there continue to be a lot of question marks and confusion over how to respond. So we've therefore been working with governments and local partners to adapt existing reporting and referral mechanisms and equip frontline workers to respond. One example is Mongolia, where we've been partnering with local multidisciplinary committees to provide case management for particularly difficult cases. And we've worked with the government to initiate a new chat box on the 108 Child Helpline with psychologists available 24 hours a day. I've spoken this week with a number of countries where we've been working creatively to adapt these mechanisms. In the West Bank, we worked with the Ministry of Social Development to adapt the case management and reporting and referral guidelines during COVID-19, and then to train child protection officers on the revised system and introduce it to other ministries and child protection actors. We've also then were able to share these revised guidelines in the cluster meetings of the Child Protection Area of Responsibility, the coordinating network for the humanitarian response, where 120 NGOs discussed how best to support the Ministry of Social Development in its implementation. This revised case management covers issues such as virtual and remote case management, when direct face-to-face meetings are necessary, and protocols for conducting face-to-face meetings. The World Vision Jerusalem West Bank office was also able to provide social workers with PPE to protect them. But I want to note the challenges with virtual and remote case management. While we've been working with governments to revise and implement these revised case management protocols, it's very difficult to assess the severity of situations virtually. A number of social workers in the West Bank, there were a number of cases in a recent reflection where they talked about while they're under strict lockdown, they were managing cases virtually that they had assessed to be mild to low moderate cases and able to manage virtually. And when they were able to, at one point, when the restrictions were eased a bit, to go and visit some households, there were a number of cases where they were shocked at how severe those cases were. And so they weren't able to, they were different than what they had been able to assess virtually. It's very challenging. It's meeting the challenge, but it's difficult for these caseworkers. Another example from Indonesia, we worked with the government to develop guidance for community-based child protection. And we've launched a training of trainers for local authorities to be able to train community child protection groups. These local community child protection groups are essential now when access is so restricted. We're working now with the government to develop operating procedures for child protection services under COVID and integrating social accountability mechanisms so that communities can hold child protection services to account for quality, accessibility, and effectiveness, even under COVID. So there's been a lot of work in this first area. Our next area in priority was the adaptation and preparation of standard procedures on alternative care for children who lose parental care when their caregivers die or are hospitalized or fall ill or are quarantined. In some countries, thankfully, this has not been a big concern with fairly low quarantine and death rates. But in some countries where we work, we are seeing real vulnerability around child separation associated with COVID-19. For example, in Kenya, which has unfortunately seen a significant increase in infection and deaths in July, protocols require people who test positive to be put into quarantine, in many cases putting children in situations of lacking parental care. Also, in certain parts of the country, we've observed a significant increase in children on the street who have shared with us that abuse and increasing household poverty are the drivers for them to leave home. We've worked with the government then to review the alternative care procedures, and we've trained over 1,000 local government administrators on these protocols. And we've trained community health workers and emergency COVID-19 response committees on the reporting and referral mechanisms. and the protocols for separated and unaccompanied children and child-headed households. And in high vulnerability districts, particularly with a lot of children on the street or growing numbers of children, we focused on identifying new foster parents and working with local government to ensure placement, monitoring, and access of foster families to the targeted cash transfer programs, as well as working on stigma reduction for the children, including child-friendly testing, so that people are willing to provide temporary foster care to children whose parents are in quarantine, and then process to work for reintegration with biological families. All of this under real challenges with COVID-19. And we've trained the health workers in the quarantine centers in child protection, safeguarding, and psychological first aid. That was in Kenya. In Somalia, we've trained, where we don't have quite the same government system, we've trained child protection and gender-based violence committees and provided PPE to them to respond to serious child protection incidents. Some of them in the camps, in the refugee camps, have included children who have been separated from caregivers temporarily or permanently, sometimes because caregivers have gone desperate to look for work. In these cases, the Child Protection Committee member has met with the camp leader and helped arrange an alternative family situation and started working for reunification with the family. The final example in this area is South Africa, which has had the most deaths in Africa. There, the government has been proactive in affirming and supporting kinship care with increased cash supports to households that have taken in children through kinship or foster care. The third and fourth areas that we're working focus on psychosocial support to caregivers and to children and adolescents have been really critical. We've been disseminating positive parenting tips and self-care messages through radio, TV, social media, and even megaphone. In some countries, we've been able to distribute kits like the tenderness boxes in Brazil. They're called, the team has called them in Brazil. These are educational kits that provide families playful activities for children during isolation. Or board games, we've developed board games promoting positive parenting and child protection in Mongolia, and digitizing life skills and child protection activities in the Philippines. We've established a Facebook group with almost 2,000 caregivers in Lebanon, with regular live broadcasts from psychologists and virtual small groups of caregivers who meet with social workers and psychologists virtually to discuss parenting challenges. We've also been in touch with over 80,000 churches and mosques, supporting them in various ways to help in the prevention of COVID, including training them in psychological first aid and monitoring of child protection issues, and supporting families with positive parenting and psychosocial support. And these faith communities are critical because they remain in the communities and in touch with people even when others are not able to be so. And finally, we're now shifting our efforts from these 4 priority areas to a more broad revision of our overall systems approach to child protection, to adapt our longer-term system strengthening approaches to this new reality, including strengthening children's life skills, resilience, and voice, social norms and behavior change, other child protection services, and social accountability for child protection. I'd like to emphasize just briefly here, I won't speak long about this, but I'd like to emphasize the important opportunities we've been able to pursue for integrated approaches to child protection, that other sectors are able to address root causes of violence against children, and also provide unique, and in some cases, due to government restrictions, the only opportunities to engage with families. As I said, I won't spend much time on this now, except we have found great opportunities to integrate child protection messages and monitoring and reporting and referral mechanisms into community health worker protocols, for example, in Kenya, but really around the world, and to integrate parenting tips and promotion of hotlines into food and cash distributions. And finally, to have integrated child protection and education support to households. I'll finish with some final thoughts on lessons and challenges, really emerging from conversations with field workers who are working in some of the most impacted places in the world under incredible challenges. First of all, the visibility and prioritization of child protection issues and children's voices. In most or even all of the countries that I've spoken to recently, field staff have shared a similar primary challenge, that governments, donors, and others are not giving adequate attention to child protection and are focusing efforts on the health and economic aspects of this crisis. Even when government child protection protocols have been revised and put in place, in many cases they are not investing in operationalizing them and implementing them. While this focus on health and economics is in some ways understandable, we need to build awareness of the critical and devastating child protection aspects of the health and economic crises. Not set up child protection as a competing crisis, but to recognize that the health and economic crises have very serious child protection implications, and to continue advocating for increased aid and government budget investment in child protection as a life-saving intervention. Also, we've heard and seen children around the world speaking and mobilizing to make a difference. They have been effectively raising awareness around the risks that children are facing and expressed a strong interest in helping prevent the spread and impact of COVID, as well as prevent violence against children. I heard from a child in the Philippines who is active in the effort to prevent child labor under COVID in her community, and I was so inspired by her. There are also many examples of children organizing to help children take care of themselves and to develop healthy self-care habits around the world. We need to continue to create spaces for children's voices and lived experience to inform the work of governments, NGOs, faith-based organizations and communities, and other stakeholders. Second is looking at the contributions of various actors to this work in child protection in these situations. It's been important in each context for us to critically consider and monitor the actual contact points with families and children. What groups and services and formats are engaging children and families directly? Local partners and organizations and services have been critical to families at this time. And we've noted that each of these areas has distinct contributions from different groups based on their context. In particular, I want to emphasize the importance of local community-based organizations and faith-based organizations and the volunteerism that we're seeing out of them even in this tough time, to be able to keep tabs on vulnerable families, provide support as they are on the ground and they know what's needed. And where we were heavily invested in local partnering and capacity building, we've been more successful, honestly, in supporting local informal child protection mechanisms that are in many cases even more critical at this time. The third point is around access to the internet and phone. Many vulnerable families do not have smartphones or computers or internet, of course, or if they do, sometimes they don't have airtime on their phones and cannot afford them. And even those families that do have a device and or internet, multiple members of the household need it for maybe multiple children trying to attend school, maybe a parent working from home. They're competing for bandwidth, competing for limited access. So even when we see data about access number of households, many of those households are struggling and cannot provide the access needed for these virtual services and supports and virtual schooling and virtual work. So in addition to contacting families and local partners through internet and phone, offices like World Vision Lebanon and Brazil have been also distributing caregiver and children packs. Others like World Vision Rwanda are reaching millions of people through radio. And there are challenges with internet and communications access also of local partners and groups. So these local groups that we need to reach virtually, they're struggling, and even local authorities in some places are struggling to have the budget to maintain the internet and airtime necessary. So for example, in the West Bank, we were able to negotiate with a phone service provider for free service to child protection networks and groups and committees and children's parliaments that were working to promote safety and protection. The fourth point, importance of social protection. Tamara highlighted this, especially social assistance through cash to alleviate the impact of economic stress and the loss of livelihoods. This is the protective nature of these interventions still needs further research, arguably, but it has great potential to prevent child marriage and child labor. The fifth point around adaptive programming, we've had to increase our commitment to devolving decision making out into the field, to the field offices and communities, and trusting local actors and groups with appropriate accountability. I think it's worth noting the creativity and quick shifts or pivots made by local and national actors to ensure that services, information, and programming continues. Next, the need for data. We had the projections in the initial part. We've been working based on projections and a lot of anecdotal data, as we often have to do. But we really need to prioritize our need for data, and also ongoing monitoring of emerging child protection issues and associated scenario planning so that we're ready if we see signs of spikes in certain contexts in child labor, child marriage, sexual exploitation, or deaths of caregivers. Number 7 here, most vulnerable children. Not everyone is affected equally, and programming and services need to reflect this. Some of the most vulnerable children are those children who are orphans or have lost parents, children living in extreme poverty, children with disabilities, hearing that coming again and again, refugees and internally displaced children, street children, or children affected by the street, and children from families who speak minority languages and are struggling to access the social services or any virtual supports. Finally, pressure on staff and volunteers. Just a last point here. All of our staff are survivors and responders in this situation. There's a lot of stress about hearing child protection issues and not being able to respond as they have previously. There are so many meetings, and many times they're juggling home responsibilities as well, and then also fear of being exposed to the virus. This week, field staff have shared with me how the situation requires patience and endurance, courage, and strength. And I'm happy to finish my presentation with this point, honoring and appreciating everyone who is creatively and courageously struggling on the front lines, the real front lines and the virtual front lines of strengthening child protection in these difficult times. I really honor and appreciate the commitment that has been made evident under these great challenges. So thank you very much, and I'm happy to pass it back to you now, Heidi.
Okay. Thank you so much, Bill and Tamara, for sharing this information with us today. Let me take the screen back real quick. Okay, so we do have a few questions that have come in. Some questions about data. One attendee is asking, what are the sources of your data on child abuse and neglect in low and middle income countries, in particular, where he says there are no established systems of reporting child abuse data, or in regions where child protection systems don't reach due to lockdown? I'm not sure which of you would like to take that.
I could go first, and then Tamara, if you have anything to add.
Okay, you go, and I'll talk about Aftershocks.
Okay, great. So where we don't have a lot of data available, which is most places we're working honestly at this point, current data, particularly as the situation is in such flux, we are relying on projections, but I think secondly what we're relying upon in the field I'm talking about is assessments that we're doing, speaking to children, even virtually. We have thousands and thousands of children that we're in contact with, and in some cases hundreds of thousands of children in particular countries, and so reaching out to them in their household through phone or through other media and with surveys, looking of course at the media. There's a lot of stories in the media, and we need to read them carefully and critically, but they are a data point. Looking at child helpline and domestic violence helpline calls, speaking to child protection committees and local authorities. So trying to build a picture, even if it's a fuzzy picture, about what is the situation for children from these data points. Of course, where we're able to do surveys, even virtual surveys, and do them in partnership with other organizations, or where governments are collecting data, that's very welcome. But we are at this point really in a situation where we try to monitor from multiple data, even whether or not they're data, multiple information sources, to build a picture, an ongoing and dynamic picture of what's happening for children. Tamara, you want to add anything to that?
Yeah, I just want to say that for this Aftershocks, particularly because we have presented some of the data per regions, and you've seen that some of those regions are low developed countries and stuff. We use the projections or the work from the global prevalence of the positive violence against children systemic review, which has been done by the CDC and a number of researchers who have systematized all the studies that were pointing out to the prevalence of violence in different regions. So we use that to make this projection. But in addition to what Bill has said, normally, if it's not a COVID situation, we also rely on information that is provided either by UNICEF or the information that is coming from the UN studies, human rights against children studies. And we then triangulate that with the
Okay. I'm sorry, Tamara, we're having a hard time hearing you, so I don't know if you can adjust your audio a little bit, but you're kind of cutting in and out, but thank you. Bill, maybe you can take the next couple of questions. Here's one. This person is asking, what are the additional sources of information that you have that have confirmed your estimates about violence against children? Are there other sources that you found that to be true?
Yeah, I mean, I think what yeah, tried to refer to a few of those, but yeah, I think we're certainly the helpline data and the hotline data in many countries has confirmed that. Also, we have data from listening to children themselves as we reach out to children. We certainly hear from children confirmations of this data. We have hear from in touch as we get in touch with child protection committees in the communities. We're in touch with thousands of child protection committees, even in particular countries. I was speaking with our Kenya child protection lead this week, and we're receiving verbal reports back from child protection committees in thousands of them around, and different health committees. Also, as community health workers are out and doing more of the home visits in some of the more restricted areas, they're reporting back these increases. So honestly, at this point, it is, I wouldn't say it's subjective, but it's messy. It is the data and the information that is confirming it is based on observation and on listening in many cases. But some of it is very structured as we've calling and touching base with households. We're seeing some of these things reported, and then obviously through these local committees and local touch points with families. And then some media reports. And then there are some assessments being undertaken. ECPAT did an assessment around online violence in Indonesia and showed a 15% of the children facing significant serious violence and harassment online. We're seeing different, the Child Protection Area of Responsibility compiled media and other data points for child labor and sexual violence. So if you go to the Child Protection Area of Responsibility, they did some, I think they call evidence briefs just this week or just last week or the beginning of this week, which were quite interesting around labor, sexual violence, and the impact of school closures. So that's a good source as well, which confirmed that these issues are taking place.
Okay, thank you. This question is about gender issues. She's asking, how do you address gender issues together with child protection? For example, violence against women and children or girls and child marriage. For example, she says sharing resources, coordinating among actors such as gender groups and children groups to collaborate together. Is there anything that you can say there?
Yeah, this is such an important area for us to continue to progress, I think, in many places. I think we've set up an unhelpful, in some cases, unhelpful, in some cases, the distinctions are important because we need to recognize that children's experiences and vulnerabilities are unique. Even compared, boys and girls are unique to each other and then unique compared to women. But there are obviously so many shared vulnerabilities and shared services and limited resources for both, that we need to look for points of synergy and continue to build on them. So in some cases, the hotlines are the same and the reporting and referral mechanisms are the same. In some cases, the caseworkers or social workers are similar. But again, it comes down very much to bandwidth. Bandwidth is, I don't know anyone working in this field, especially on the front end of this field, who isn't overwhelmed. So but we look for opportunities to do that, and many of our committees in refugee camps, for example, are looking at both women and children vulnerability or incidents of abuse and exploitation. So I think it's an important area for us to continue to grow and to recognize that gender also between boys and girls, the vulnerabilities differ. So and then of course looking at the connections to intimate partner violence. Tamara, do you have anything to add on that? We'll see if your sound is okay.
I hope you hear me as
Yeah,
well.
yeah.
That's better.
On the global level, we also work very closely with Girls Not Brides, who are one of the largest networks on ending child marriage. We work on global level and on national level, particularly our colleagues that are engaged in ending child marriage are working with the coalition really strongly. We also work with Together for Girls. So we are trying to bridge these issues and look at the child violence against children, and as Bill was talking about, also as a and it's in its forms that are gender-based, and work with those groups that are able to help us and this practice and prevent it better. Thank you. I think Billy said everything.
Okay, great. Thank you. Here's a question related to places where there is no access to phone or internet. He's asking, what kind of platform or media would you recommend, most especially for GIDA, to report child violence in places with no access to phone or internet?
I'm not
Sorry, I don't know.
sure.
I'm not sure what the abbreviation GIDA means.
Me neither, but I think I can guess. I think
Okay.
the focus of the question is clear enough. But if my response doesn't speak specifically to nuance in the question, please welcome a follow-up. Yeah, this is it's a terribly serious challenge, and in some places I know that in Mongolia, for example, when the COVID was first coming online, quite early in Mongolia, many children were sent to be with grandparents out in the very, very remote rural areas, and were in many cases we didn't have follow-up, even local authorities, others, information, ways to contact them, and were made much more vulnerable to abuse, exploitation, neglect, and just lack of access to services and even potential schooling and information. And we see around the world where children and families and parents don't have, and caregivers don't have access to social media or phone. Of course, they are more vulnerable. And so, but what we've done, this is the situation in many countries and in many parts of many countries where we work, is the establishment of local committees. In many cases, these local committees can be contacted at least weekly. And so we have set up protocols in some countries. For example, again, I'll refer back to Kenya, where we have regular weekly connections with these child protection committees through the local authorities that are maybe at the district level, and then child protection committees out in the villages that are able to monitor and respond initially to child protection incidents, and then seek support for those which are serious or criminal and criminal. So this is these informal child protection systems and informal actors have been essential and critical. They always are. They're often the places that people trust most anyway in times of crisis. But in these particular times when social workers in some cases are restricted from going out and doing, or other government authorities are restricted, or they're focused on other priorities, or just honestly in some cases afraid. These local committees have been essential to be able to maintain the monitoring, collecting reports. And then, yeah, I think that's been our main outreach. Community health workers as well. In many countries, community health workers, when everyone else is locked down, they've still been provided with PPE and the mandate to go and visit homes. And so we've focused a lot of our efforts on helping those community health workers to be able to recognize signs of abuse or exploitation or other forms of harm, child marriage, child labor, and to be able to respond to those appropriately with psychological first aid, but also with a better understanding of the reporting mechanisms to be able to seek support for the serious cases which are out there.
Okay, great. And you may have addressed this, but we have a question about the role of teachers and school staff. This person is asking if you uh, recommend building capacity among teachers who are part of an online or distance learning program to ensure child safeguarding and protection. Again, I'm not sure if you may have addressed this.
Oh, we absolutely do. Teachers are essential these days they're always essential as element of the child protection system, but in particular now, and teachers are really struggling. They're really struggling. I believe it was either World Vision Indonesia or in the West Bank I was speaking to this week, and they talked about how are developing a psychosocial support modules for teachers, because teachers are also under really serious stress and pressure these days. And while we look to them to be even virtually able to engage with children effectively, they're under a lot of pressure and stress and doing things which they didn't sign up to do, having to teach in a way that they didn't anticipate, and facing a lot of pressures at home with multiple mandates. And So I think one is just support to teachers and recognizing that while we all depend on them and look to them to be creative these days, they've taken on a huge load of stress in their homes and in their work. Second, I think, yeah, we certainly are also training teachers, one, to be more effective in being able to work remotely and virtually, because very few of them were ready for this pivot. Of course, none of us were, but their pivot has been just absolute and entire in terms of their teaching environment. So I know, for example, the Ministry of Education in Lebanon has really focused this summer during the summer break, on building the capacity of teachers to be able to work better virtually and remotely, but also to be able to recognize signs of abuse, even in those conversations and the virtual connections they have with students, and to help students to be able to understand the risks of being online and to be online safely. Teachers are an important means of sharing that information with children and caregivers around safe use of the internet, which is, of course, a critical concern these days.
Okay, great. Thank you for that. And we have a question here. You mentioned that you've seen an increase in children who are participating in various places in ensuring child protection of others. And this attendee is asking if you could talk to maybe some standard operating procedures that are being followed in these cases, and if the children feel safe in that role.
Hmm. Tamara, you want to share to that, or would you like me to respond?
You go ahead, Bill.
Okay, all right. Yeah, I mean, we in all our engagement with children, we have we conduct risk assessments beforehand to ensure that we're whatever the specific opportunity is, whether it's a virtual piece of virtual research or a social some sort of activism online or creative outreach to their peers, that we are conducting a risk assessment. We've developed guidelines for caregivers. Well, we've taken guidelines from the World Health Organization for caregivers and for children for safe internet use. We have developed guidelines internally for working safe facilitation of adolescent groups online, and for other working with children, communicating with children online and directly and through phones. So we've had to develop new guidelines internally for that, because always with children's voice, raising and amplifying children's voices, we have to look at risk. But in this particular case, we've realized that we've also internally had to develop skills to be able to do that well. So yeah, I think it's an important area for us to all keep while we're enthusiastic and we recognize that children's voices and lived experiences are the fundamental measure of the effectiveness of a child protection system. We need to recognize that we need to support and promote their voices in ways which are safe for them and appropriate, given the risks that they face.
Okay, great. Thank you. And if we could just squeeze in one final question here. This one just came in. It's interesting question. She's asking if you're seeing any evidence of an increase in children committing violent acts around the world.
I haven't seen a lot of evidence of that, except it depends on how. I would be very careful in this response. So I would say first, no. I think I haven't heard reports of that, and that may be because more children are just inside and being kept at home and not going to school, and so the opportunity for violent acts may have been reduced. What we've seen, something not, I wouldn't call it a violent act at all, but related tangentially. We've seen in some areas a lot of adolescent pregnancy with peers, with adolescents having sex together and in increased rates. And we see that in some of the slums in Kenya, I was hearing this week. And some of that sex is violence. A lot of it is consensual, but it's certainly resulting in a lot more adolescent pregnancy, which puts children much higher risk of not returning to school, which sets them on a trajectory of vulnerability. And so while some of that has been violent, a lot of it has been consensual, or at least not violent in that way. And so it's certainly putting children at risk, and we're seeing increased rates of that in a number of places where we work.
Okay. All right. Thank you. And maybe just to end on a positive note. So it seems like the involvement of children in child protection is one thing that could be seen as very positive. Are there any other lessons being learned that you would say can maybe strengthen child protection going forward during this challenging time?
I'll give a very quick response, and then Tamara, if you want to add anything. I would say one, yes, children's own courage and creativity has been inspiring. The commitment of local volunteers and committees and local organizations and faith-based organizations to continue to reach out to households, even when there's been a lot of unknown risk. It's been profoundly inspiring. People have demonstrated real courage and commitment to children's well-being in that, and I would honor that as really demonstration that there's plenty of good people in the world taking risks for good things, not just they just don't hit the media very often, and certainly been inspiring to me. Tamara, anything to add?
Well, first, a few things. One, in relationship to child participation. Yeah, I hope you hear me now very well. Well,
Yes.
we've seen that children are an amazing advocates and champions for the issues of child protection. And when they are given an opportunity to share their experiences, whether it's something that they whether it's the violence that they have experienced and they are survivors of violence, or whether it's the activities that they have done to prevent it, it's a very powerful testimony and sends a very strong message to the policymakers and message to the public. And I think we need to continue to create these spaces for children's voices to be heard, because the message that they bring from their own experience is always far stronger than what we can say. And we work certainly with young people. Yeah, we have a young leaders program that is enabling, that is actually creating the opportunities for them to speak about the issues that they find important for them globally, not just in their communities, but locally and globally. The second thing that I want to say is, every time that we face with the times of a crisis, or where we facing, whether that crisis is as a man-made or it's an economic crisis, whatever, we always have this issue of data and an issue of being able to draw the proper attention to the issue of violence against children. So I think we believe that this crisis has to create an opportunity for us to collect better data on what is really happening in our communities, what is really happening with children, how these kind of events can increase the risk, and what these risks are, and what is really working. So we have to continue to document and share and learn, and this opportunity that this is creating on talking about these issues and sharing our experiences is extremely important, and I think that that's one of the things that we really need to continue be doing in an absence of ability of governments or willingness of governments sometimes put in place administrative systems that are catching this data. And finally, what I want to say is, I, as someone who's been a long time in this field, and I'm probably most of you much longer than me, and you see that we know what needs to be done many times. We have often a very good understanding of the problem, but we are seeing, and we don't see enough action. And part of that is maybe because there is not enough political will, but there is also not enough demand to change things from the public. And I think one of the reasons why we did the Aftershocks report is to be putting that pressure, is to build on that kind of tension that was being created around the violence against women or domestic violence in initial phases of the COVID response. And this is a really strong opportunity to continue putting this issue into headlines. And I know that that sounds a little bit opportunistic, but it is really important that there is a demand from the public for politicians and for policymakers to finally pay attention to this issue as that deserves, and to finally start making choices in their policy that are going to ensure that we don't have to scrape for resources, that we don't have to respond to this issue last, and then we do really recognize the importance of investing in preventing violence for the future of our children. Thank you.
Okay, thank you so much. Thank you, everyone in the audience, for your questions today, and thank you again to our speakers for sharing this information, and thank you to World Vision for all the amazing work that you're doing. I would like to conclude by, one moment. Okay, I would like to conclude by encouraging those in the audience who are not members of ISPCAN to become a member so we can continue having webinars like these. Our member benefits include a subscription to our monthly research journal, access to our past webinars and other educational resources, and the ISPCAN child abuse screening tools, as well as discounts to our international congresses, which we're planning to resume in 2021. We offer several membership levels, including our new associate membership at $35 a year. We also invite you to visit our COVID-19 resources page for a variety of resources for professionals, parents, and children. You'll also find information about our upcoming webinars, including our next one on August 6th with Louise Dalton and Elizabeth Rappa on talking to children about death and illness. To learn more about ISPCAN, please visit us at www.ispcan.org. A recording and the slides from today's webinar will be posted on our website shortly. If you have any questions or comments about today's webinar or upcoming webinars, please contact us at resources@ispcan.org. Thank you all again for joining us today. We hope you stay safe and healthy and have a great day or night, depending on where you are. Thank you, Bill. Thank you, Tamara.
Thank you. Goodbye, everyone.
Goodbye.
Okay. All right. Bye-bye.